My name is Richard Day. I'm the Principal Investigator of the AMELIE Project. I'm based at University College London, where I'm a Professor of Regenerative Medicine. So the patient group that we're trying to treat in the AMELIE Project are women that have sustained what we call obstetric trauma. So that's injury to the muscles that control continence that have been damaged during childbirth. So this is quite a common effect of childbirth, or associated effect of childbirth, and effectively what happens is that the muscle that normally closes off the canal is torn. It can be restored by surgical repair, but effectively that muscle gets scarred. So scarred muscle doesn't function in the same way as healthy muscle, and you effectively become incontinent. So the group of patients at the moment is primarily women with obstetric trauma injury that have incontinence, and we want to try and restore the muscle function so that their bowel continence is also restored. So the idea behind the AMELIE Project is that cells, particularly muscle cells, when they are in the body, in a person, they're normally anchored to a surface. So they're not floating around, they're not like blood cells, they exist adhered to a tissue, in that case muscle. If you want to replace the muscle because it's either been damaged or lost due to injury, the idea of being able to replace that damaged muscles is to use cells from the patient that can go in, be transplanted back into the patient and restore muscle function. Those cells like to be attached to the surface of something when they're being delivered. If you just deliver them in suspension, meaning not attached to anything, a large proportion of those cells won't survive. So you'll be injecting effectively dead cells into the patient, which isn't then going to form new muscle. The idea behind AMELIE is we deliver the cells, the muscle cells, into the patient, attached to the surface of what we call a microcarrier. So this is a small sort of bead of material that degrades when it's in the body, but is used for attaching the cells for delivery into the patient. The idea then is that the cells will be released from the microbead when it starts to degrade and will engraft with the host muscle and restore muscle function. The AMELIE Project is using a new form of regenerative medicine. So regenerative medicine aims to restore the function of organs and tissues in the body. Previously, for incontinence, cells have been used to try and restore the muscle function. So that means cells that have been taken from the patient that's incontinent have been isolated, they've then been grown and then implanted back into the patient. There have been mixed outcomes with those studies. Some studies that have been conducted to date show some effect, other studies show no effect. So what we're proposing is something completely novel, in that we want to deliver cells in a more natural state. So that means that the cells are attached to a substrate or a material so that they're being delivered into the body in a form that matches more closely how they would exist ordinarily inside the patient. The idea there is that we think that the cells that will be delivered will be what we call more viable, so more alive, than if we just delivered the cells in a suspension without any microcarrier or attachment substrate. So I started working in the field of regenerative medicine probably about 20 years ago, when I was based at a hospital that specialised in colorectal disease, St Mark's Hospital in London. And at the time there was quite a lot of interest in alternatives to transplantation and organ transplantation. So the idea at the time was, could we grow artificial intestine or bowel for patients with conditions where they've had large portions of their bowel resected? So we worked along those lines and ideas for a few years, and we're looking at different sorts of materials that could be used as what we call scaffolds to support cells that grow normally in the body in tissues, but when they're taken out of the body they need to have a structure or substrate to be able to grow into. So the idea there was, could we make a material that would support cell growth? At the time we were looking at a condition called fistulas, and we're still actually looking at that separately to the AMELIE Project. That enabled us to develop a material that would be used as a filler material when we were developing that material, we realised cells like to grow on the surface, and so that eventually evolved into the technology that we're now looking at in AMELIE. The AMELIE project started based on an idea that we had to be able to use materials to deliver cells. So this was an idea that we initially tested in the laboratory away from patients, and we demonstrated that muscle cells could grow on the surface of these materials, the microcarriers, and that the cells weren't affected once they'd been cultured on the surface of these materials. To be able to take this into patients for a study to look at whether it's effective in restoring continence, we have to go through a series of stages to demonstrate, first of all, safety, and we conduct some preclinical studies that demonstrate that the material and the cells, when they're combined, are safe, effectively. We then have to enter into what we call an early phase clinical study, and this is to demonstrate in a small number of patients that the product is, first of all, safe, and secondly, that it's likely to have a beneficial effect, so that what we call efficacy. That means that the number of episodes of incontinence that the patient may have is reduced, and that there's evidence that the muscle function is restored and improved muscle strength occurs in the sphincter muscle that controls bowel control. The most exciting part of the AMELIE project so far has been bringing together people from a diverse range of backgrounds, areas of research and expertise. So the AMELIE project is very multidisciplinary. We've got a range of scientists from various different backgrounds. We've got a range of clinicians from across different sites, ranging across different countries in Europe. And we've got people that are engaged in public engagement and making sure that we engage with the public. This is a very important part of the project, to be able to ensure that what we do as researchers is communicated with the broader general public.